afternoon. How are you feeling? Well, my name's Yvette, and right now you're in our care. A Good Samaritan had seen you. Looked like you might have been passed out or blacked out at a theater. Do you have any recollection of that? Well, they called an ambulance, and you were very, very disoriented when you first came in, so we set you up in a room someplace nice and calm and quiet that you could hopefully get your bearings back. Okay, well, it's okay. You can just take your time and breathe. There's no pressure, no expectations here, okay? We don't really know a whole lot about you. Do you mind telling me your name? Well, you're in a safe space. If you need time alone, let me know. Is there anyone that you can think of that you would like to contact? Any family, any friends? Okay. Alright. Sometimes just taking a time out. Of course. Can I get you anything to drink? Anything to eat? Do you have any kind of food allergies or anything like that that we should be aware of? Okay. Well, there's some bottled water on the bed beside you, so if you feel so inclined, feel free to help yourself, okay? Would it be okay for me to do some preliminary testing to see whether or not this might have been a neurological event? Can you recall any of the last events in the last couple of days, maybe even couple of weeks? Dealing with a lot of stress? Okay. Well, we're going to try to keep things as uneventful and no pressure here, okay? And there's no expectations, so if you can't remember, we'll just go from there. Do you have any history of drug use or alcohol use? There's no judgments. Just trying to treat you the best way we can, okay? Alright. Well, if it's okay, do you mind if I take your pulse? If I just touch the side of your neck here? Okay. Just gonna touch your forehead here. Just get a baseline about temperature. Okay. Do you know if you've had a fever or anything like that in the last couple of days? I'll just put a new head on this. Can I take your temperature? Okay. Thank you. Just take a moment. Sometimes it takes more than a moment. There we go. Okay, so it doesn't appear that you're running a fever. Low-grade fever, everything's okay. Can you hold out your hands for me? I just want to feel your pulse on both your wrists. Okay, thank you. Yeah, just checking for symmetry as well. Mm-hmm. And if I touch your face just a little bit here, I'm going to be checking for any kind of bruises, any kind of scratches on your scalp, cuts, anything like that that might be tender. Okay. Yeah, because we don't exactly know where or what happened. We just want to make sure that you didn't take a fall, if you did bump your head or something like that. Okay. Do you mind if I get a little close to you? Thank you. fingertips over your scalp a little bit. Is that okay? It's okay. You're alright. You're safe here. If you need a moment, just tell me you need a moment. Okay. Like I said, there's no rush. Okay. Does any of this hurt? I'm gonna run my fingertips over your scalp. I mean, I don't see any lesions or bruising. Your hair is a little bit displaced, but nothing injured, at least as far as I can tell or feel. But just let me know if you feel something different, okay? I'm gonna reach into the back. Do you mind if I pull down on your eyelids? And just look up for me, okay? A little bit red, a little bit dry. Okay, now I'm gonna do the same, but other side. Do you mind looking down for me? I'm gonna pull up. Just gonna take my light. Sorry, it's gonna be a little bright. You okay? Okay. I don't see anything like debris, but you do have a little bit of swelling going on here. Does it feel like if you cry, you know how your eyes feel kind of swollen and achy? Do you feel like that might have happened? Okay. It's okay. You're alright. Just breathe. Just breathe. You're in a safe place here. You can just take a time out if you need to, okay? It's alright. I'm not going to push you to do anything. And if you don't want to see anybody, you don't want visitors, I'm okay with that too, okay? I can always come back a different time. Okay. Just focus on breathing. I just want to make sure you're okay. Do you mind if I lift up on your nose here? Just want to see if anything has been affected. Okay, so I'm going to use my little lens to just move the tip of your nose up just a bit. The tissue is nice and pink. Yeah, it looks nice and healthy. No lesions, no blood, nothing. Does it feel uncomfortable? Or like if it's just swollen? Okay. Do you mind if I palpate those areas around your face, your sinuses, around the underside of your eyes and your temples? Okay. I'll try to be gentle. And your temples right here. They okay? In front of your ears right here. move down your neck a little bit. Just palpate your lymph glands here along your chin. Sometimes if you're experiencing an illness or something, this area can be really tender and really swollen. Does that feel uncomfortable? I mean, it's a little bit swollen, a little bit, especially right around that V area on your neck. It could just also be tight muscles. I'm going to try moving your windpipe just side to side just a little bit. Some people might find this a little uncomfortable, okay? Okay. Just going to keep palpating down your chest a little bit here, your clavicle area. No tenderness, no bruising, anything like that you can feel. Okay. Do you mind if I move like the collar of your shirt over so I can take a better look? Thank you. What about your shoulder? If I squeeze your shoulder, does this feel okay? It does? Okay. Take a look at your other side here. If I squeeze your shoulder again. That's good. Do you mind if I do some compressions down your arms? Okay. Let me know if any of these areas are tender. Again, we're looking for bruises. Flex your elbows. No hesitation, no resistance. Do you mind if I pull your sleeve up? Are these scars new? Okay. It's okay if you don't want to talk about it. It's okay. Just know you're safe here, okay? Whatever decision you make. Okay. Mind if I check your other arm? Okay. Good. Flex your elbow. There's no major restrictions there. Good. No pain. Okay, just gonna pull your sleeve a little bit. Do you want to talk about it? I won't judge. If you ever do decide you want to talk about it, don't hesitate, okay? I just want to make sure that we can take as good a care of you as possible. Okay. Oh, it's okay. I'm sorry, I didn't mean to bring up something that might be painful for you. Just have a couple sips of water, take a couple deep breaths. Okay. This isn't in a hurry. You're safe. Take all the time that you need to, okay? Okay. Can I check your breathing? Your heart rate? Okay. Thank you. Just try to breathe as normal as possible, okay? Close your eyes. Just try to sink back into the bed and be comfortable if you can. giving me just a little cough. And again. Okay. Your lungs do sound clear, so that's always good. I'm going to use the bell of my stethoscope here to take a listen to your heart specifically. So, nothing special, just try to relax, okay? Do you mind lifting up your arm just a little bit? Okay, thank you. Just going to tuck this under here. I want to hear your bottom right chamber. Okay. Alright, sounds good. Your chest is clear. It doesn't sound like you have anything built up in your lungs. Have you been experiencing any kind of difficulties breathing? Not that you can remember. Good. Okay. Do you mind if I move down to some of your lower extremities? Your ankles, your knees? Okay, thank you. Just gonna back up here a bit. And do you mind if I put my hand up on your calf muscle by your knee? Okay. If I kind of palpate pressure, does any of this hurt? Okay. How about on this side? Anything? Okay. How about your feet? Do they feel okay? Good. Temperature is good. Both feet are consistent. Symmetrical. Knees. Okay. Alright. Tummy. Tell me if any of this is uncomfortable, alright? Alright. Try to be gentle. I just kind of palpate in your tummy area here. Is it okay? No pain? Good, good. Are you up for a little exercise? It won't be super strenuous. I'm going to use a light. I'm going to hold it to one side. I'm going to have you follow my finger, and then we'll switch sides and do it again. I'm just going to be looking for your pupil constriction based on the angle that you're looking at to see if there's any strain that happens, okay? Okay. See, it's not too hard, I promise. Okay. Just follow my finger. Do you feel like your eyes twitching at all? Yeah, I can see that just a bit. Do that again. This side. Just follow the finger best you can. There's no right or wrong. Okay. How many fingers am I holding up? Okay. Do you mind if I get a little close? I'm going to lift up your eyelid. Get really, really close in with the light. I want to see if there's any debris or anything that might be stuck in the back of your eyes. Okay. Take a deep breath. It's okay. Just trying to help. probably get you some eye drops. And that will help with some of the dryness, also the inflammation. I'd like to take a quick peek in your mouth to see if you have any kind of bite marks or if you've damaged any of your teeth. I know if you have a blackout and you fall, you don't always have control over where you land. Just like to make sure that you didn't bite your tongue, didn't bite any cheek, anything like that. Just going to use this stick to kind of move your cheek around, move your tongue around, so that I can see different parts of your mouth. Just try to relax your jaw. Oh, you're shaking. Are you okay? Okay, you can take a moment. It's alright. It's alright. Take your time. Also, if you just want some time alone, there's tissues. We can call family or friends if you'd like. Okay. Just focus on breathing for a little bit. Water sometimes helps as well. You're right. Ready? Give it one more shot. Okay. Then I'll leave you alone, I promise. Alright. Okay. Just want to make sure you didn't damage any of these pretty teeth. Your tongue is good. You don't have... If you did fall, it doesn't look like you bit your tongue. Does it feel sore anywhere if I go over it like this? Oh, that's good. That looks alright. One last thing, I'm going to just, from the outside, run my hands along the teeth. I'm going to press in on your cheeks, so you might feel a little bit of pressure there, but if you have a bruise or if you have a damaged root or tooth, you'll have a spike of pain. Okay. So, is that okay with you? Alright, thank you. Try to be good and gentle, but we're also looking to make sure that nothing is damaged, or if it is, that we can take care of it, okay? No pain? That's good. That's good. The temperature of yours is a little warm, but do you have a history of anxiety or panic attacks that you're aware of? Do you normally see anybody about that? Would you like to? There's no expectations. It's not like an exam. There's no right answers, wrong answers, but if you have someone that you can feel maybe comfortable talking to, those situations, stress, managing. Okay. Well, I'm here if you ever want to talk about it. I won't judge. You can always just say whatever's on your mind. Sometimes just having somebody else hear you makes you feel like you don't have to carry that weight all by yourself. Of course. Well, you appear to be physically in good health. Well, you appear to be physically in good health. So, I'll let you take a little bit of a rest. If you need anything, just hit the call button. I'll come right in, okay? Okay. You're safe here. It's alright. If there's anyone that you want me to call for you, let me know, okay? Alright. Take care, sweetie. I'll be right back when you're ready.